Welcome back to the Medigap Show. I'm your host, Holly Cohen, licensed agent and also founder of MedigapCares.org. Don't mess with my Medicare. Today, we have an eye-opening article to discuss. But before we jump in, make sure to subscribe to the channel and hit that bell icon so that you're notified every time a new video comes out. Today, we'll be delving into an article titled, Overpayments to Medicare Advantage Exceed $75 billion annually. New analysis warns. Written by Daniel Ellis and published on News Medical Life Sciences. Let's explore the key insights together. So, according to a recent analysis by researchers at the USC Schaefer Center for Health Policy and Economics, overpayments to Medicare Advantage plans now exceeds 20% or $75 billion annually. This highlights the urgent need for reform in our Medicare system. Medicare Advantage program enrollment has surpassed that of traditional or original Medicare. Paul Ginsberg, a senior fellow at the USC Schaefer Center, emphasizes the need to reform the payment structure for Medicare Advantage plans. The current system leads to overpayments higher than previously estimated. The analysis indicates that Medicare Advantage plans may be overpaid by $27 billion or 6% in 2023, primarily due to coding differences and excessive quality bonuses. However, this estimate does not account for the impact of spending differences between Medicare Advantage and traditional Medicare. The researchers suggest two key strategies to improve rate-setting accuracy. The first is reforming the current payment approach by reducing aggressive coding and improving data reporting requirements. The second option is implementing competitive bids by Medicare Advantage plan carriers. It's crucial for policymakers to address these overpayments to ensure the fiscal solvency of the Medicare program. Don't mess with my Medicare. Without reforms, the cost of overpayment will continue to rise, posing a threat to federal healthcare spending. So let's dive into this article about overpayments to Medicare Advantage plans exceeds $75 billion annually. New analysis warns. And this is on News Medical Life Sciences site. This was written by Danielle Ellis. Enrollment in the Medicare Advantage program, which allows Medicare beneficiaries to get their health care through plans administered by private insurance companies, has been growing so rapidly that it has recently surpassed enrollment in traditional Medicare. A new analysis by USC researchers warns that overpayments to Medicare Advantage plans now exceed 20% or $75 billion annually, underscoring the urgent need for reform. Researchers with the USC Schaefer Center for Health Policy and Economics found that the millions of beneficiaries in traditional Medicare who have switched to Medicare Advantage have lower spending than those with similar health risks who remain. They report this pattern of favorable selection more than doubles prior overpayment estimates made by the Medicare Payment Advisory Commission, which is MedPAC, which reflected aggressive coding of enrollee health conditions plus certain easily achieved bonus payments related to quality, but did not include favorable selection. The Centers for Medicare and Medicaid Services, CMS, sets Medicare Advantage payments based on county-level expenditures derived from claims data for those remaining in traditional Medicare, not data from Medicare Advantage expenditures, a payment mechanism that is fueling concern. And it also says here in a little excerpt, the current Medicare Advantage payment structure results in overpayments markedly higher than previously understood. Our analysis highlights how Medicare Advantage currently operates and the need to reform how the plans are paid. That was written by Paul Ginsberg, who is a senior fellow at the USC Schaefer Center and professor of the practice at the USC Price School of Public Policy. Medicare Advantage plan enrollment surpassing traditional Medicare. Medicare Advantage has experienced substantial growth, with more than half of Medicare beneficiaries opting for the private insurance plans over the traditional or original Medicare program, in which CMS acts as the insurer, processing claims and reimbursing most providers directly. So what it's stating here is when someone is on traditional or original Medicare, CMS, which is the Center for Medicare and Medicaid, acts as the insurer, meaning they are your insurance company. That's who your doctors and hospitals are billing. So it says, which CMS acts as the insurer, processing claims and reimbursing most providers directly. Now, on the other hand, the article goes on to explain, with Medicare Advantage, CMS, again, that is Medicare, transfers risk to private insurers, which receive a fixed monthly capitation amount per beneficiary, which means the government, or CMS, Medicare, pays a fixed monthly amount per beneficiary on Medicare Advantage. It's typically, from what I've always heard, $1,000 per month, which equals $12,000 a year, to take someone off the federal Medicare system, the traditional Medicare, and put them on Medicare Advantage. So I was just clarifying that. With Medicare Advantage, CMS transfers risk to private insurers, which receive a fixed monthly capitation amount per beneficiary. Medicare Advantage plans earn profit or incur loss based on enrollees' healthcare service utilization. Pay close attention to that. I'm going to have future videos. There's a lot coming up on what is happening right now and why next year they're saying that the Medicare Advantage plan premiums, which have typically been zero, are going to go higher in 2024. They're actually going to cost something rather than be zero. So that's why this article is important, and I'm trying to explain it. And then next video, one of the next videos that are going to come out, I'm going to explain how the premiums on Medicare Advantage will be higher than $0 per month. The researchers found that Medicare Advantage beneficiaries had significantly lower expenditures than those remaining in traditional Medicare with similar risk factors. In 2020, 46.9%, 11.3 million of Medicare beneficiary Advantage enrollees had switched from traditional Medicare in 2006 to 2019, just counting 29.5%, which is 7.1 billion, who switched to Medicare Advantage in 2015 to 2019. Payments to plans for these beneficiaries were twice their expected expenditures. The skewed distribution of expenditures and the consistent trend of beneficiaries with below average spending choosing Medicare Advantage plans has significant financial implications and are adding to the fiscal strain on the Medicare system, says Stephen Lieberman, a non-resident senior fellow at the USC Schaefer Center. Reform options must strive to improve the relationship between FFS expenditures and Medicare Advantage payments. Another option is to de-link Medicare Advantage payments from FFS as the current rate setting system grows increasingly unreliable and problematic. So what they're explaining is the Medicare Advantage payments from CMS, from Medicare, from our federal government, they're estimating the payments based on traditional Medicare, which is a completely different way to be on Medicare. So that's why they need to reform the way that the payment structure is set up to pay these Medicare Advantage insurance carriers from the federal government or from Medicare. Okay. Improving accuracy of Medicare Advantage rate setting. The researchers point to two key strategies to improve rate setting. Reform the current payment approach, linking plan rates to average spending by traditional Medicare beneficiaries. This could include measures to reduce the impact of aggressive coding by plans and mandating new data reporting requirements for Medicare Advantage plans to improve accuracy, completeness, and comparability of the data to make it akin to claims data in traditional Medicare. Another option, abandon the current approach and institute competitive bidding by Medicare Advantage plans. This option could use market forces to determine what Medicare, that CMS or our federal government, pays Medicare Advantage. That means they're referring to private insurers who run the Medicare Advantage program and plans, with the aim of capturing efficiency gains for taxpayers instead of higher benefits or profits for Medicare Advantage plans. Regardless of which approach is chosen, policymakers should proceed with a solution to shore up the fiscal solvency of the Medicare Trust Fund and the impact on overall federal budget deficits, notes Ginsburg. Without reform, the researchers concluded that overpayments to Medicare Advantage plans will only increase, costing tens of billions in federal healthcare spending and threatening the long-term viability of the Medicare program. That's all for today on this article. I'm going to include the link in my description below. Very important to stick to the channel closely so you can understand what is happening coming up for 2024 for these Medicare Advantage plans and the changes that are coming. So stick close. I'm going to keep trying to make new videos about the updated changes literally that have even happened in the last 3 days about 2024 Medicare Advantage plans. Okay. Thank you for watching, and we'll see you next time on Medigap Show.